Hi, my name is Sam Philpott, and I'll be covering clinical data analytics. Data analytics has always been used in healthcare. Some of you might be familiar with the Charlson Index. This was created in 1987. It's used to predict the patient's life expectancy given the range of comorbid conditions. This is helpful, for example, if a patient has cancer but also heart disease and diabetes. The risk of cancer treatment might outweigh the short-term benefit. Also, some of you might be familiar with the LACE index. It was created in 2010. It identifies patients that are at risk of readmission or death within 30 days of discharge. This is a model taken from data from all over the country. This is based on length of stay, acuity of admission, comorbidities, and the number of emergency department visits. Okay, so what's changed? We live in a time in which computational power continues to grow, and we're producing an unprecedented amount of data. More data will be created in 2017 than in the previous 5,000 years of humanity. Although previous index models are definitely helpful for insights, there's certain limitations. We have better machine learning tools, especially with artificial intelligence, that can give us deeper insight. Also, analytics are much more pervasive today, and there's a larger amount of data availability. The challenges facing healthcare with data analytics are making analytics a routine, pervasive, and actionable. Healthcare providers need to fully leverage the analytics environment. Also, have a standardized set of tools and methods, and deploy a strategy of intervention. Industrial companies have been using data analytics for predictive maintenance. For example, GE has sensors on jet engines to better predict engine failure. I mean, obviously, you would much rather repair the engine when it's on the ground of a jet airplane versus when you have hundreds of people up in the air and have some type of problem, okay? Also, many oil companies are developing predictive maintenance for oil wells. These are companies that have wells spread out over large geographic areas, and they have a limited amount of people to service these wells. So if one of them gets shut down, even within a day, they can lose millions of dollars in production. So they're beginning to use these strategies to help be able to drive more income in their business. So one of the things looked at in healthcare analytics is using a similar technique in which, let's say, a patient has left the hospital and we can see that there's been a spike, for example, in their glucose level. Rather than for them to wait until some type of major medical issue, they would be able to come into the hospital and see exactly what's going on before they end up in the emergency room. Also, predicting something is not good enough. You must have the data to act and intervene, and the organizational wherewithal to intervene. How and why something will happen is more important than when it will happen. The main point I'd like to drive home is that there are unique challenges in data analytics when it comes to healthcare. We have to keep in mind we're dealing with humans who don't always make decisions based totally on data. And what do I mean by that? If I were to tell you that we've now developed the technology in which a car can drive itself better than you can as the driver. Would you be willing to get in that car on a freeway and not be behind the steering wheel? I know for myself, I would be reluctant to do so, even if you provide me with data that proves it's much safer to allow the car to drive itself. So this applies to healthcare. We don't necessarily make decisions solely on data. We're dealing with human beings. And that's the main point I want to drive home.